Hi, it's Dr. Ingalls from We Care Frisco, and today I'm going to be talking to Becca, a nurse practitioner with Vive Hydration. She's actually going to be at the clinic this coming Wednesday, July 31st from 1 to 5. She and her partner, Jana, are going to be doing IVs all afternoon. So if you decide you want to get an IV, please call the clinic at 972-668-2636 or go to our website at wecarefrisco.com to sign up. And we have a special promo code if you're on this webinar. You just need to mention webinar or type it in the form when you sign up, and we'll give you an extra 5% off. And then as we're doing today's webinar, if you have any questions come up, please don't hesitate to put it in the chat, and then I'm going to try to get to that at the end and answer all the questions. So I'll go ahead and get started. So Becca is one of the co-founders behind Vive Hydration. She's originally from upstate New York, and she kicked off her nursing career back in 2014, specializing in psychiatry. Fast forward to 2017, she became a nurse practitioner in integrative healthcare. Every day she blends the best of traditional and natural care to give patients and their families a well-rounded experience. She is passionate about weaving together science and wellness and creating a space where patients can recharge and feel amazing. So Becca, how did you get into IV therapy to begin with?
Great question. So I actually started doing IVs when I was struggling with migraines a lot, and it was one of the only things that really seemed to help. And then while working in integrative healthcare, just seeing the profound impact of nutrients on patients was amazing. So that's kind of where Jen and I came up with that idea.
Okay, and so for some people that have never had IVs before, can you explain a little bit about what IV therapy is and like just a little background about that?
Yeah, so IV therapy is basically just delivering vitamins and minerals, sometimes medicines, directly into the bloodstream. And by doing that, um, you're bypassing the gut, and so you're getting more effective and rapid absorption.
Okay, and what are some of the benefits of IV therapy? Like, why would somebody decide to do it?
Yeah, we do it a lot for athletes for performance and recovery, immune support, hydration. It boosts energy levels. Um, Kind of can help with all sorts of things. Some people do it for migraines, allergy relief, hangovers.
hmm And I've seen some people go get them after they have COVID or if they're about to go travel and they want to prevent getting
Yes.
sick or something like that, they might get the immune one. Is that right? Or the
Yep,
Myers
yep. That one's
cocktail.
really popular.
Okay.
Pre and post travel, yeah. Or a lot of times we'll get parents who get it when their kids get sick. They get an immunity bag to prevent them getting from sick.
And do you think it helps you get over viruses better? Like if you have a virus that's lingering and you're just not getting better, would it help to get one at that point?
Absolutely, yeah, for sure.
Okay. And so how exactly does it bypass the gut?
So it goes directly into the bloodstream, and because of that, it's a much more effective absorption. Um, when you take pills orally, it anywhere from I want to say 1% to 50% absorption rate, where when you do it through the bloodstream, it's essentially 100% absorption. And with that, there's less side effects as well because it bypasses the gut. So really ideal for people who struggle with IBS and leaky gut. Um, and it can also help in gut health and healing as well.
Okay. And then I've heard recently about NAD, like some people do it for longevity and different reasons. Can you tell a little bit about why someone would do NAD and what are the benefits?
Yeah, NAD is amazing. I love NAD. A lot of people know it as an anti-aging drug. It's very preventative against cardiovascular um, and brain diseases. But it's essentially a coenzyme found in every living cell of the body. It plays a crucial role in metabolic processes, DNA repair, gene expression. Um, and so it helps improve circadian rhythm, regulates hormones, balances neurotransmitters, um, very powerful anti-inflammatory, um, and it boosts metabolism.
And I've heard if you get it IV, it can take a long time and maybe cause side effects. So do you guys do it IV or you do it IM, like straight into the muscle?
We typically do IM because of the side effects. The IV can take sometimes up to 8 hours, depending on how well you tolerate it and how much you're getting. Where the injection's obviously very quick and relatively similar absorption rates as well. Um, but with IM, the side effects are much less and pass a lot quicker.
Okay. And would you need to do that like once a week or something to get the full benefit of
Yeah,
NAD?
generally once or twice a week. Mhm.
Okay. All right. And can you tell us a little bit about your most popular IVs that people do regularly?
Yeah, great question. So, one of the most popular is called Thrive. It's a bag we built specifically for athletes. So it really helps with performance and endurance. And I can break it down a little bit too to kind of help people understand um, like what each ingredient does. Glutathione's in it, which helps reduce oxidative stress and inflammation. B complex helps produce energy and improve metabolic processes. It repairs and regenerates tissues and reduces the risk of cramps. Amino acids help repair muscles. It improves blood flow and oxygen, which also helps increase energy levels and endurance. And it helps maintain fluid balance. Vitamin C is in it, which helps improve collagen production um, and aids in the synthesis of carnitine, which converts fat into energy. Um, It neutralizes free radicals, which aids in muscle repair and helps decrease soreness, and then enhanced iron absorption, which carries oxygen to the muscles. Magnesium is really great at preventing cramps and muscle spasms. Also helps maintain the electrolyte balance and anti-inflammatory. It does help strengthen bones as well and regulates heart rhythm and blood pressure, leading to increased performance and endurance. Calcium improves bone health and strength and helps in the transmission of nerve impulses to muscles to help muscles work more effectively.
Mhm.
Um, Helps promote faster wound healing, balances hormone levels, and also helps to maintain that healthy heart rhythm.
Okay.
B12 converts food into energy to help with energy levels as well.
Okay. So that sounds like a good one. Do athletes usually do that before their event or after or both?
Usually before and during, like if they're training intensely, they'll do it throughout the week as well,
Okay. Because
but definitely before an event.
sometimes when I play in a pickleball tournament, I'll go get an IV before it to give me enough hydration if I know I'm going to be sweating in the heat, and then I'll get another one at the end
Oh,
just
cool. Do you notice the
to
difference when
recover.
you do that?
Yeah, I recover a lot faster. Yeah,
That's awesome. Yeah,
yeah. And I'm able to stay out in the heat better because I tend to cramp and stuff like that. So it prevents all of that.
that's great. Yeah, I love IVs.
Um, and then you have another one called migraine. Is that right? Is it,
Yes. Mhm.
is that what it's called? Migraine? Or
Yeah, we
is
have
it?
one for
Okay.
migraine.
Okay. And so what all is in that one?
So that one has Benadryl, which helps reduce histamine levels. Histamine contributes to inflammation and blood vessel dilation in the brain. So it kind of helps with the muscle relaxing. Benadryl also enhances effects of other medications used to treat migraines, which allows for better absorption of other stuff and helps modulate the central nervous system pathways involved in the transmission of pain.
Okay.
Reglan's in it, which is like an anti-nausea that works by blocking dopamine receptors. It also enhances gastric motility, which helps move food and medicine through the GI system. And
Hmm.
then it also reduces sensory sensitivity that a lot of people get with migraines. Toradol is also in that, which is a big anti-inflammatory and powerful pain relief.
Hmm.
And the magnesium as well, which helps relax muscle tension and stabilizes blood vessel function.
Okay. And you said back when you first got into IVs, you got into it because of migraines, right?
Yep, for sure.
So were you doing
Helps a
one
lot.
like this or a different one?
Yeah,
Re
similar to this.
Mhm.
And I was doing it when it just got so bad I like couldn't function anymore. But I started to do it preventatively, and I rarely get a migraine anymore.
Okay, that's great because I have a lot of patients with migraines and it's always tricky to know what to give them or how to help them. So this would be a good
Yeah,
option.
yeah,
Okay.
for sure.
Um, and then what would you say is the importance of doing IV therapy preventively in general versus acutely?
I think in general, it's if you can do it preventatively, it's great because you're going to keep your nutrient levels consistent. You're not going to, have risk of deficiencies. Energy levels are generally higher. And then it does reduce the frequency and severity of flare-ups. So if people get migraines, hopefully they get less or less severe ones,
Mhm.
um, or like chronic conditions too, the inflammatory part of it. It also keeps your body detoxing, which if your body's detoxing regularly, it's gonna function a lot better overall.
All right. And then do you have some people that sign up for IVs just because they're tired of taking supplements, like they have pill fatigue?
Yes, absolutely. A lot of people come to us for that reason. They're sick of taking their pills, and they generally feel better after doing an IV versus even a month of supplements because of the absorption. Um, but it is nice. A lot of supplements you can come off of if you're doing IV therapy regularly.
Okay. And then how does someone know that they're getting high quality ingredients in the IV?
So this is really important to us given our background in integrative healthcare. So we really work to find that high quality ingredients and get stuff without preservatives or everything we have is methylated. So it's already active and that there's no issues with absorption because of that as well.
Okay, great. And then are some of yours IV push versus getting a whole bag? Like tell us a little bit about when would you do a whole bag versus an IV push?
Yeah, great question. So a lot of our bags have a combination of several different methods. So some supplements can only be given intramuscularly via like a shot. Some can only be pushed. And then, depending on what type of bag or what we're putting in the bag, some cannot be mixed together. Um, there were newer regulations that only allow 3 supplements in an IV bag. So, because of that, some of the stuff we would normally put in a bag have now had to be moved to push.
Okay. And what do you mean by push? Is that just they already have the IV and you just inject a little bit more of that special nutrient? Is that what you mean?
Yeah, so the they're hooked up to the IV, but we push
Hmm.
it directly into the vein rather than pushing it in the bag and then dripping it into the vein.
Okay.
And just it's a, depend the uh, absorption and delivery is dependent on that as well.
Okay. Um, and then I know some people that have never had IVs might be nervous about the safety and things like that. Can you address some of those concerns that people might have?
Yeah, we really try to work with patients on this as it is a very common concern. We go over, your health history before making sure you're a candidate for IV therapy. Um, but we have very strict protocols that we follow, and we both took the course at IV Therapy Academy, which really made us well versed and knowledgeable in this area. Um, we'll sometimes do some homeopathic or natural things to help if patients are really nervous, too, to help with that. But we really try to work with you and talk you through everything as well. And overall, patients are like, wow, that wasn't nearly as bad as I thought. A lot of times it's the anticipation more than anything.
Yeah. Um, okay. And then can you think of any times when there's a contraindication indication to getting an IV? Like when should someone not get one?
Yeah, there's very few, but the biggest are usually related to like congestive heart failure, kidney failure, some or anything with edema. So we'll kind of ask you more questions about those things if you have that to determine if you're a good candidate. Otherwise, most people are pretty good candidates.
Yeah. And then do you have some patients that get them regularly, like once a week or?
Yeah, we have some do it once a week, some every other week, some once a month, but a lot of our patients tend to do it pretty regularly.
Okay. And if someone, I know we're going to have you in our clinic next week with your partner, Jana. So just for everyone listening, that's going to be on Wednesday, July 31st from 1 to 5. So if you decide you want to get an IV, please call the clinic or just go to our website at wecarefrisco.com and mention the promo code webinar for your discount. We're going to give everyone 5% off in addition to their membership discount if they mention that promo code. So if someone wants to look at your website, how can they find you?
It's just vivewithus.com.
Okay, so just so everyone knows, Becca and Jana, they have a mobile company. So you can look at their website, look at the menu of all the IVs, and then give us a call if you want to do it. And in the chat, there was one question. He's asking, is there any more risk involved with a push versus the IV?
Because it's delivered more like faster, there is a slightly higher risk, but we're not usually doing risky IV pushes. But good question.
Okay. Um, all right. Well, I don't see any other questions, so I guess we will wrap it up here. But thank you so much for being with us tonight, and I look forward to seeing you next week at the clinic.
Yeah, thanks for having us. We're excited.
All right. Have a good night.